Welcome to the Pharmacy Residency Podcast, a member of the Pharmacy Podcast Network. I wanted to talk to you about a new Facebook group, Pharmacy Staff for COVID-19 Support. And it's a public group that started on March 15th, and here we are on March 21st, and it almost has 10,000 members. The person who started it, his name's Stephen Meyer. He's a pharmacist, and he has a specialty pharmacy in Blue Ash, Ohio. And he was able to close his doors so that he can do what he does and change, to what most of his work is done by courier anyway. So, unfortunately, retail has not done this yet, and maybe they'll do this soon. But we really need to make clear that we need to protect our pharmacists on the front lines. It is just unconscionable that we don't have the personal protective equipment when we are dealing with literally thousands and thousands of people that are coming into contact with it. And while I'm in one of the states that has under 50, certainly there are other states, Washington and New York, that have many, many thousands who will get the disease or has the disease now. So the first thing I just want to encourage you is to join the pharmacy staff for COVID-19 support. I know that all of the organizations, APHA, ASHP, AACP, AMCP, all of those put together this document and saying what it is that they want. But I think what we really need to see is a completely unified voice, so that it was the AMA that was going to and talk to President Trump and his group saying, look, one, we need PPE, and two, we really need to get this vaccine, or we really need to get these drugs going. And it was a single group and just saying one or two things that they need. And I think that that's what we definitely need to do. But also, I think that we need to be able to talk to each other and figure out some solutions for what's happening right now on the front lines. There are a number of things that were really a concern as we kind of look at the social boards and see what people are talking about with residency and without. So the first thing is job security. Pharmacists actually, in a poll that Student Loan Planner did, came out first in terms of job security. Now, those of you that are still looking for jobs, I understand this is not much of a comfort, but my thought is that right now, as it seems that every time a pharmacist gets the COVID virus, we're going to need another pharmacist to go in there. And I think that there's going to be many, many people, especially parents, that are saying, look, I am a single parent. If I go, there's no one for my kids. I can't be in there. And I feel like we're going to be in a position where we're actually going to have a shortage of pharmacists that are available to serve the needs of the patients. And obviously with this oversupply that we've had for so long, all of a sudden to have this massive thing coming where we might have an undersupply is a completely change. And now we also need to implement telepharmacy, and we need to implement all of these things. So it just was a really interesting article. You can read it, but basically it came down to, I know pharmacists were on the list, physicians, nurse practitioners, nurses, architects. If we think of maybe what are the things that we need to do to put in these barriers and all these other things to protect people? And then if you just think of food and shelter, and not obviously the restaurant industry has been decimated, but we're talking about like grocery stores and things like that. And I feel like we're keeping places open, but we're not making those changes that we need to make to really make it so that they're safe. But in terms of job security, pharmacy is actually number one of all of the professions. And I just feel my heart goes out to the other professions that are on the exact opposite side of the spectrum. You're talking about the dentists, ophthalmologists, those people who would come in contact and have extremely high risk without being able to protect themselves. And so Obviously it's just ironic that it would take a global crisis to recognize how important pharmacists are to the health system, and that the one place that they are just not willing to close is allowing people to get their medicines so they can continue to live healthily. Second, you're going to hear about canceled APPEs. Now, every school is doing this differently. One school, I think, made a blanket cancellation. I can't verify that. I know that the school in town or next door for Block 9 has made some very clear delineations, like try to work it out, try to make it remote, and then don't put yourself in a position where you have to go. We're not telling you you have to go, with many hospitals saying that you are not necessary personnel as students. It's again ironic that those people and that work that you're going to be doing in just a couple of months as a licensee is something that you're not allowed to do as a student just before graduation. So it's just, I understand it and I get it, but it's just kind of ironic that you're going into a critical care position, but right now you can't go to a Block 9 rotation, so you can't graduate, so you can't start your critical care position. And what I'm seeing residencies are doing is they're saying, well, even if you got a residency and your college won't let you graduate because of this thing, they would let you stay on as a graduate intern. Now, how would you get the hours and things like that? That I don't know. But I think it's absolutely ridiculous that ACPE is sticking to this 1440 and saying that in some way Block 9 has to be this particular experience. Otherwise, you're not a pharmacist. It is completely arbitrary. We were perfectly doing fine as pharmacists when we had bachelor's degrees just before I got into pharmacy school in 1996. So, just because it worked out in such a way that one of your rotations is one of the core, and that maybe you have 1440 exactly instead of 1600 like other schools, I think that's kind of ridiculous. And hopefully they'll make accommodation as residencies are starting to. The last thing I wanted to talk about was residency alternatives. Obviously, some people didn't match. Some people are trying in phase two. But it's really going to come down to, do you want to work in pharmacy? Because the positions are going to be opening. We are in a war, and we're going to lose a number of people. And I'm not saying to death, but I'm saying that they're going to be not able to work for 14 days. But that takes out the entire pharmacy staff. So you need to restaff the entire pharmacy and have people come in. So it's going to be, are you going to want to put yourself in that kind of a position? Maybe you don't have children. Maybe you are willing to do that. I don't know. So I'll keep you up to date as things are happening. But right now, I think most courageous people out there right now are those people that are in those retail stores that have no personal protective equipment or little personal protective equipment. People are just coming over the counters like, hey, I saw you didn't have toilet paper, or hey, I saw you didn't have this really unnecessary item in stock, or something like that. And they're not able to protect themselves. There's no reason that if we can put blast shields down in the more dangerous neighborhoods, that we can't put blast shields down in all of the stores. And that's why the architects are going to be really essential to this. So last thing I want to leave you with is just, it really is going to be cooperation. And I think social distancing is the wrong word, as somebody said. Yes, we are physically distancing, but I think that we should be socially coming together. So I encourage you to go into that Facebook group. I know the LTC, or long-term care group, with Michelle Lamb, is also having something on shortages. The LTC Pharmacist Connection, I think it is, if I remember right, yeah, which has 3,000 members. They're going to have a discussion on disaster resources, I know, with ASCP. And really, just getting into these groups is absolutely critical as you see these. So it's going to be Friday, March 27th at 11 a.m. Drug shortages, the crisis within the crisis, and how we can help. So forget about this provider status stuff. Forget about asking right now. Right now, let's just see how we can best serve. And then when the dust settles, we can say, look, This is what we did during the crisis. Look what we were able to do. Then, we can worry more about the actual legislation going through. But right now, let's just figure out how we can best help other people, but also be very safe. I have a family. I know many, many pharmacists have families, and it's absolutely critical that we get that PPE and those blast shields up.
Hey, thanks again for listening to the Pharmacy Residency Podcast. I do encourage you to go to residencyhelp.com, get on the mailing list. I'll send you out an email every Friday during residency season, but then afterwards, I'll still have a number of episodes on helping you get through residency itself. And then if you're somebody that's looking at residency in the future, I'll also have content for that as well. If you have a question, I'm pretty good about getting back to you. And if I don't have an answer, I will know someone that does. So thanks again for listening to the Pharmacy Residency Podcast. And if you're on Apple Podcasts, please do rate and review. It really matters in terms of our ability to reach more people. Thanks again.